Hello, and thanks for joining us for It's Okay Not to Be Okay. I'm Margie O'Brien. As of right now, we are changing the conversation about mental health and substance use in Rhode Island. The stigma around it can be paralyzing, but there is help available. You don't have to go it alone. We'll share 4 stories of heartbreak and inspiration, and you'll also learn the first step to finding help is a phone call away. It is our hope that after tonight you'll know it's okay not to be okay. It's a startling statistic, a measure of a mental health crisis impacting police officers and firefighters across the country. First responders are now more likely to die from suicide than in the line of duty, a problem nationwide and here at home. NBC 10 investigative reporter Katie Davis has been tracking these cases and what's being done to turn things around.
Sebastian, you gonna hit the ball again?
Mom of 3, Ashley Wall, is doing something she never imagined.
All right, hit it back.
Raising her 2 young sons and newborn daughter without a partner.
I've officially come to hate the phrase that things happen for a reason. You know, somebody who says that has not had something truly horrific happen to them.
Her husband, Jeremy Wall, died by suicide in February while Ashley was pregnant with their daughter.
Going through the delivery without him and bringing her home without him and going to my first pediatrician appointment without him because he was a very involved dad and he was always there for all of that. So I'm thankful for her. She's, you know, my last piece of him that he has left me with. And I am forever grateful for that.
Jeremy's firefighting gear hangs proudly above the family's front door. He was a 13-year veteran of the Cranston Fire Department. His picture hangs in the Oaklawn Avenue firehouse, his cubby left empty as a sign of respect. Ashley learned her husband is part of an alarming trend, one of 6 Rhode Island firefighters and 1 police officer to die by suicide this year.
It's heartbreaking. You wonder why. I know for the years that I've been with Jeremy, I have not seen this many suicides within the first responding community within Rhode Island.
A report from the Rudderman Family Foundation found first responders nationwide are now more likely to die by suicide than on the job.
So it's in all of our best interest to make sure that we do a better job of caring for our first responders.
The report's author, Marian Heyman, says mental health should be treated like what it is, an issue of officer safety.
The police officers and the firefighters need to hear that message from their superiors. That's where the cultural change will come from.
It's horrible that we haven't addressed this, and it's not a simple solution. It's a continuous culture change.
Providence Public Safety Commissioner Steve Perry is responsible for the largest group of firefighters and police officers in the state.
Firefighters and police see a lot of trauma, from the elderly to little kids, and that adds up, and I've seen it in the 2 departments that I've worked with. I wish I had the answer.
Part of the challenge for police officers in particular, controversial shootings and other incidents across the country. Viral videos may lead people to distrust officers in their own communities.
When you see the bad shootings and use of force, people look down upon police officers, so we got to change that.
Adding to the problem is a culture of keeping quiet. Police officers and firefighters may fear that asking for help will derail their careers.
They'll never come forward if they have that fear.
Therapist Hallie Fleischman of Brightside Behavioral Health works with Rhode Island first responders.
I think I've seen a trend. More people are coming to help, but I think we need to talk even more about it.
She says long hours and unpredictable shifts can take a serious toll.
They still have to be a husband, a wife, a mother, a father, a sister, a brother. They still need to be there to support their own, and it's so very difficult when you carry so much around with you. There are people that do understand, and there are people that want to help.
Instead of staying silent, Ashley Wall is making a conscious effort to talk about suicide and mental health.
You know, and if we just start talking about it more and just normalizing mental illnesses more as a community and become more accepting of it, then the conversation changes and maybe we'll see less of this.
Hoping to honor her husband's memory by creating change.
Boy, our hearts really go out to Ashley and her family. So Katie, is there a push to change the mindset? These people we think of as our saviors, but really they need some saving.
I think leaders in the profession are finally starting to recognize that, and the experts that I talk with say really that's how change has to happen from the top if leaders make it okay to ask for help. So one thing that they're pushing for is more peer support programs. They do have a program at Providence PD and some other larger departments, but they want to expand that out statewide and include some of the smaller police departments, and also include firefighters, because traditionally they haven't had these programs, and maybe the thinking has been that they're not exposed to as much trauma as police officers, but in fact they are, because they answer so many medical calls and emergencies. So there is a push now to think both about firefighters, police officers in larger departments and smaller departments as well.
And those numbers are staggering.
Thinking of the fact that we had 6 firefighters die this way, 1 police officer, that's 7 people in Rhode Island, which is a small state, only about 1 million people. So when you think of that and how many people in the state are in this profession, it really gives you pause. You realize how serious it is.
Absolutely, and we've just learned that BH Link has a survivors group for the spouses of these people, and we're told that it's really helping.
Absolutely, because I think, you know, those are the folks who are going to best understand what these people are going through, whether it's a widow or a widower, and also what the job was like. Ashley Wall talked about, you know, just all the stresses of the job that her husband was going through, and it's hard to understand that if you don't also come from that background in your family.
BH Link is designed to help Rhode Islanders dealing with behavioral health issues get immediate help for themselves or for their friends and family. Having one central location that is a 24-hour triage center providing care to people who are in need of immediate assistance is the goal of BH Link. BH Link was created in 2018 and has already served thousands of Rhode Islanders. A 24/7 hotline, formal clinical assessments, and peer specialists on site are just a few of the services offered at BH Link. Rhode Islanders dealing with mental health or substance use disorders can find resources, support information, and most importantly, hope at the BH Link Center in East Providence, and additional resources on the website. For more information, you can see their website at bhlink.org or call them at 401-414-LINK. That's 401-414-5465. When we hear the numbers associated with the opioid crisis, it's overwhelming, and we wonder, when will they stop growing? One industry hit hardest by this crisis is the building trades: electricians, roofers, contractors, men and women who are at more of a risk of being hurt on the job because they rely so heavily on their bodies to get the work done. ABC 6 reporter Ellie Romano looks at what's being done to educate workers in the trades to tackle opioid use and to help them on the path to recovery.
Hidden under the hard hat is an alarming statistic.
So 1 out of every 5 overdose deaths involved a construction worker.
The Rhode Island Department of Health tracked nearly 1,000 opioid overdose deaths from 2016 to 2018. During that time, 20% of the deadly overdoses were from people who work in the construction field.
99% of them were men, and over half of them were in a younger age group, that 25 to 44 age group.
The startling statistic encompasses anyone in the construction trade or extraction field.
Electricians, roofers, people who actually do building, carpenters, masonry.
Do you think that 1 in 5 is on par with what you see?
I think that I do notice more people on opiates. I can tell, you know, by their eyes, by the way they're acting.
Kristen Scungio has been a part of the construction trade as a painter since she was 17. But that's also when she started abusing opioids.
I started on Oxycontins. I was snorting them.
Heroin took over her life for the next 5 years.
Out of all the drugs I did, heroin definitely brought me to my bottom quickest.
Her addiction followed her everywhere, even to work on job sites.
I fell asleep on lifts, like crash into the corner of walls, like nodding out. I was just like falling asleep in closets. It was just really messed up. I was definitely becoming a safety hazard.
Tell me a little bit about what made you want to get clean.
I totaled my car into oncoming traffic. My relationships were all deteriorating. Just my whole life went downhill. It got to the point where I was like sleeping in parks. Just nothing mattered except heroin.
Scungio checked into a rehabilitation facility and quit cold turkey.
I just wanted to get my body off of this like slavery.
It took 2 years, but then she was free and ready to take her life back.
I was a little nervous going back into the trades because obviously drugs are prominent there.
But she's been able to stay sober for 7 years, and during that time has noticed a shift in the industry to try and cut back on opioid abuse.
My business agent, you know, like will stand up and offer like resources for people with mental health or drug addiction. I think that's huge.
Similar initiatives are now being rolled out by the organization Building Futures.
Just being able to have a conversation about your health and well-being is something that we need to practice.
Rachel Miller is training tradespeople like Scungio how to avoid injury on the job so they can avoid getting prescribed opioids in the first place.
We talk a lot about if you are prescribed opioids, because there's a lot of appropriate uses, right? Like how to be safe in that use and how to manage it and how to, again, talk openly about it.
And talking about it really works. It helps Scungio on her way to recovery.
I think the most like amazing thing that came out of getting clean was healing the pain that I didn't even realize I needed to heal and being able to be content in my own body.
The Department of Health is now looking into the big question: why construction workers are dying at the highest rate from opioids.
Good, solid, evidence-based public health takes time. I didn't say a decade, but I think it's at least a couple of years before we have a good idea of the why. Until
then, Dr. Jim McDonald and the state are working to make Narcan more widely available.
We want to have the antidote out there because we know that there are people who have opioid use disorder. They're going to be using illicit opioids. We need to have strategies to help rescue them so they'll be ready to enter into a time of treatment.
He also says we as a nation need to work together on destigmatizing opioid misuse.
People need our help at that point. They really need our love, our support, and they don't need our judgment. It just isn't helpful.
So returning back to the workplace, the neighborhood, the home, that's always the challenge for people in recovery. What can we do to help?
So Scungio did say she was nervous about returning, and she said when she got back she was able to stay clean because no one approached her trying to use drugs or sell her drugs. And she said that she could tell there was a difference between people who were using versus not, so she would just stay away from that crowd. So that helped being able to acknowledge where to go and where to stay away from. And then you heard from the Building Futures team, which is partnering with the state and is actually going into trades communities and trying to train people on how to avoid getting involved with opioids in the first place or at all. And if they do need to get prescribed opioids for surgery or for any reason, how to use them properly so that if you are going to be involved with these really addictive drugs, you're at least going to use them safely.
Well, it's promising that the support is there.
Yeah, and it's a new effort that the state has been working with since this study came out.
Rhode Island's construction industry is taking on the opioid crisis and substance use problem head on. 1 in 5 overdose deaths are individuals who work in the construction industry. Building Futures helps to prepare workers to meet employer needs in the construction and building trades. As part of the workforce response to the opioid crisis, they've partnered with industry organizations and their own graduates in a program called Recovery Through Opportunity. Together, they are training leaders, administrators, and workers in 3 key areas: prevention, support, and rescue, helping to sustain and protect the workforce. Workers in other industries like the fishing industry and hospitality, who are also looking for ways to cope, can find resources too at BH Link. BH PHLink is a 24/7 triage center equipped with the people and resources to get you the help you need. You can call them at 401-414-LINK. That's 401-414-5465. Teen suicide rates are on the decline. For the second year in a row, Rhode Island had the lowest rate in the country. This according to America's Health Ranking, which monitors and compares percentages around the country. And locally, that's good news. But students in Portsmouth know firsthand that one is too many. Since losing a friend to suicide in 2018, students there have rallied to make changes, socially, even legislatively, in the hopes of making schools accountable for dealing with mental health issues. Eyewitness News reporter Walt Buteau shares with us a story about this community coming together and the friends who want to make sure a life is remembered and another life not lost.
If things were different,
we're going to break up into groups. We have 20 blankets to do.
This crowd of Portsmouth High School students cutting,
perfect,
tying,
oh, you guys are good,
creating blankets for patients at Hasbro Children's Hospital might have included the teenager who now inspires them.
I very much enjoy it.
One of Nathan Bruno's best friends says he would have been the one cracking jokes as he worked.
I just remember he's a super funny kid.
Owen Ross met Nate in 5th grade.
He would just walk around the hallways and it would just be like an inside joke. He'd scream shark, and then everyone would drop to the ground just for no reason. It's just he just made every situation super funny.
Nate was about 4 months shy of his 16th birthday when his father noticed a difference. He remembers bringing it up at the dinner table.
I said, hey Nate, I feel like something's off. What is it? And he just said, Dad, I just feel like nowadays kids have it harder.
Right when it happened, it was horrible, but then even in the days after, it was kind of just getting worse before it got better.
And then you're going to tie the 2 blankets together.
Stephen Peterson, who helped organize the hands and hearts behind this blanket-making factory, was Bruno's boss at a local restaurant after the 15-year-old ended his life in February of 2018. His friends went to Peterson.
Really, it just started out with a couple of guys meeting and saying, this is how we feel, and then they're saying, but we want to make some change happen. We don't want this to just have happened and we move on and we think about Nathan and we cry about it. We do these sort of things. We want something positive to come. We want to make sure that the way we feel right now is not a way that anybody else ever feels again.
Peterson knocked on Bruno's front door looking for the okay to start what's blossomed.
Zip right through all of these.
Into every student initiative and Be Great for Nate.
They wanted to raise the awareness of what they would see in a friend if they were under stress.
They're hearing about it on Smith Hill.
This is not an easy process.
On this afternoon, every student initiative is getting a crash course in civics from Portsmouth Senator James Seveny, one of the sponsors of a bill that would change how schools handle mental health issues.
We've changed our strategies of how we're going to go about it.
Colin Cord is the student organization's policy director, determined to nudge the bill out of committee before he graduates next year.
And we will have a larger group go up there to try and push the process forward.
To make yourself a part of the process is it's really powerful. People pay attention to that.
Doing the same thing we did last year, but we're going to be doing it repetitively this year, working harder, get more people.
So this will go somewhere. You will get it done, and we'll help.
If passed, the law would require teachers and staff to be educated annually about the signs they should look for in a stressed student. There would also be new protocol for notifying parents. Nate's father tells us his son's case did not involve clinical depression, drugs, or alcohol, and there were no red flags pointing to suicide. But he says knowing more sooner would have been vital.
If we could have cut Nathan's stress back by 5 to 6 weeks, we could have reached him a lot sooner in that emotional support.
Just reaching out to a kid that's having a problem may in fact steer you clear of something that blossoms into a real tragedy.
They tell us their aim is way higher than getting a law passed. They want to make a global impact by building a model other communities can use.
I really do think that this youth movement, this generation, is going to be the one that can end suicide. but there's so much work to be done.
Be Great for Nate is already training Portsmouth students about the signs to look for and how to help classmates realize their problems are not too big, that it's okay not to be okay.
That's one of the stigmas that we bring up, like things that we try to break down, like boys don't cry, and like if you have mental illness, you're weak, and all that kind of stuff. That's just what we kind of want to get out of people's heads.
Well, I love that the kids went to an adult and said, this is how we're feeling, what can we do? But how do we change that to have them say, this is what we're seeing and hearing, what can we do?
That's exactly what Be Great for Nate is about. It's not about getting to a kid who's near that horrible decision. It's about getting to the kid long before they make it, about noticing certain signs in the hallway and certain signs in their attitude, and talking to them, and then knowing which adult to go to with this information without feeling like a tattletale, as we used to say.
And they're really pushing for it. This wants to be a big model for the state.
Multiple of the founders of this organization, they want it to be a model for the world. They want an international, multi-million-dollar sort of nonprofit. In fact, one of the students we talked to is going to college to do just that.
I hope he gets the support.
I think he hopes so too, and a lot of people hope that.
Kids Link Rhode Island is a hotline for parents and guardians to use to find help for children experiencing an emotional crisis. The toll-free hotline connects parents and caregivers to resources available in the Ocean State to determine the best places to go for emergency services and treatment options. Families who are trying to deal with behavioral issues in school, lashing out at friends or family members, or children who are dealing with excessive anxiety or sadness are all areas that the Kids Link professionals can assist with. Call them at 1-855-543-5465. And again, the free hotline is 1-855-543-5465. Finding help through a phone call, 414-LINK, 414-5465. Such a simple number, but one that could save yours or your loved one's life. It will connect you to Rhode Island's only mental health triage center, BH Link. And once connected, a path to recovery is not only created, it's supported.
Those bridges and those trees on my way home that day were very enticing. It was no longer safe to drive myself home. And I truly believe if I wasn't a mom, I might not be here.
Danielle Hebert had gone off her medication when pregnant with her second child. After his birth, she found the demands of everyday life too much to handle.
I struggled the last few years. My anxiety and depression got quite a bit worse after my second child was born in 2016. I had postpartum depression that I ignored and pushed aside and made sure I kept being the full-time working mom, also the soccer mom, and checking all those silly boxes that we hold ourselves accountable to.
When she decided she wasn't safe anymore, her word, her husband found help.
So 414-LINK is the telephone number to call. That's the best way to kind of say, here's what's going on for me, and I don't know what to do next.
Often for clients like Danielle, the first interaction with BH Link will help to carve out a plan for wellness. Jim Rysick, CEO of Horizon Healthcare Partners, says unlike emergency departments around the state, which see a host of different issues and traumas, BH Link meets the needs of only those suffering from a mental health or substance use crisis. BH Link was designed to be the antithesis of an ED from the moment you walk in the door.
It's a more dimly lit, calming environment. The way that the treatment bays are arranged with recliners instead of a gurney, makes somebody more comfortable.
When I walked in the door here, I was just overwhelmed with a sense of calm. A calm I hadn't felt in years.
Everyone who comes through the door is unique. Everyone who comes through the door is actually a puzzle that we need to figure out and help put together.
You and I
scrape our knee, need to go get stitches and so forth. You go to the hospital, your coworkers say, I'm sorry. There's a sympathy to physical health injuries and seeking the help that you might need if you're sick. By talking about it, we need to make sure we have the same kind of conversation about mental health.
First Gentleman Andy Moffat has the unique opportunity to lend his voice to the campaign, It's Okay Not to Be Okay.
The last thing I'd want is for them to be ashamed of whatever struggle they have, to hide it. I think it's particularly acute for men. It's so, as a man, I just thought it'd be worth, trying to add my voice to it.
BH Link, Melissa speaking. How may I help you?
A suicide hotline, also manned 24/7, has proven to be a lifeline, fielding over 100 calls a week. And if need be, BH Link dispatches a van with a trained clinician aboard to go to the person in need and bring them into the center.
Yeah, people have emailed us and said, you literally saved our lives.
You need to live your best life. You deserve it. Everyone deserves it. You need to love to wake up to crazy kids and a messy house and a mountain of laundry. You need to be able to tackle that and love every minute.
For behavioral health care service during a crisis, take down this information and keep it nearby. bhlink.org or the hotline at 401-414-LINK. That's 401-414-5465. Thank you for joining us, but we're not done yet. Please follow us over to Rhode Island PBS to continue the conversation. It's okay not to be okay. Link is designed to help Rhode Islanders dealing with behavioral health issues get immediate help for themselves or for their friends and family. Having one central location that is a 24-hour triage center providing care to people who are in need of immediate assistance is the goal of BH Link. BH Link was created in 2018 and has already served thousands of Rhode Islanders. A 24/7 hotline, formal clinical assessments, and peer specialists on site are just a few of the services offered at BH Link. Rhode Islanders dealing with mental health or substance use disorders can find resources, support information, and most importantly, hope at the BH Link Center in East Providence and additional resources on the website. For more information, you can see their website at bhlink.org or call them at 401-414-LINK. That's 401-414-5465.